Hello learners, today we are going to discuss about BPC 145 block 3, that is counseling skills and techniques. So in this we'll see three units today, unit 7, unit 8 and unit 9. Let us discuss first unit 7, that is counseling skills and techniques. So in this unit we are going to discuss about rapport building, person-centered counseling techniques, basic skills required for counseling, case history and interview, psychoeducation, conflict resolution, grief and bereavement counseling. So the objective of this unit is to understand various techniques of counseling, to use them effectively during counseling session. So counseling is needed to solve some particular life problems. We all know that we have to face some problem at some or the other time, and we have to seek help to resolve the problem, to understand the problem, to solve the problem. It can also be sought to maximize the human growth potential. So in one side it can solve the problem, another side it can work for the growth of the person. Let us see what is rapport formation. So this is the ability to connect with others, creating a climate of trust and understanding. So rapport means if you are able to establish the relationship, professional relationship with the client, which gives the client trust and understanding. Okay, and if you can maintain the confidentiality. So like foundation, it is foundation of counseling and first objective of counseling. If there is no rapport, you cannot proceed in counseling. It is the first requirement, we all know that. And it creates a psychologically safe and secure environment for the client. That's why most of the clients, when they talk to friends or family members, they are not so open. But when they talk to clients, they share lots of their issues. So it helps in building trust and confidence in counselor, and it is a continuous process. So it's not like that once you have to just establish rapport, then you forget about this. So like the each and every session and the whole session it requires. So what? Let us see the requirement for rapport building. So you should maintain the confidentiality and informed consent. Like you must inform your client that uh, you are going to discuss about this thing. If client say yes, then you can. Like if client is not very comfortable in discussing his or her problem, then you are not supposed to discuss those problems with the client. First, make him or her comfortable, then you can discuss. So it is like briefing about roles of counselor and client. So before starting the session, you must brief about yourself and the role, what is your role and what is the client's role. And being predictable and consistent. So the therapy should not be unpredictable, and creating an environment of trust, safety and openness, and should not jump to conclusion or make assumptions immediately. And you have to wait for the acceptability in the client, then only you can share the conclusion or whatever assumptions you have thought for. So let us see what are the requirements for person-centered counseling and what is it. So client-centered or Rogerian counseling or non-directive supportive therapy. These are the different various names of client-centered therapy or person-centered therapy. It is centered around the clients. That's why it is called client-centered therapy. Rapport formation occupies an important place in this therapy and brought the concept of free will and emphasis on positive aspect of the psyche rather than just negative and maladaptive aspects. So client is the best authority on her or his own experience, and there is no concept of illness, therefore patient word has been abandoned. So in client-centered approach, counselors or therapists generally they use the word client rather than patient. So, like client-centered therapy suggests for warmth in the relationship between client and counselor. So, this is the core thing in client-centered therapy. Both work on the warmth and unconditional positive regard, and empathy paves the way to readjustment. So, this is the job of the counselor to pay always unconditional regard. There should not be any condition like you are not putting the condition if you come on time then only I am going to see you, if you are on come on appointments, if you don't miss appointment then only I see you. In case of addiction you are not putting the condition like if you want to smoke then only I am going to see you, if you don't drink then only I am going to see you. No such condition. So whatever clients say, whatever clients share, the therapist role is non-judgmental. The therapist doesn't judge the uh, client and always have regard for the client. Then empathy. So this is the role of the counselor. This is the job of the counselor to develop empathy and to show it. If the client, if the therapist or counselor has not expert in having empathy, empathic understanding, then counseling cannot be done. It helps in reconnecting with the disintegrated feelings. So there are feelings, behavior, emotions, all are disconnected. So client-centered therapy basically helps in integration. The counselor needs to remain non-judgmental, as I already told you, throughout the course of counseling. So the core concepts in client-centered therapy is unconditional positive regard, non-judgmental attitude, and empathy. So let us see the important features of client-centered therapy. What are the techniques? So client is treated as a person, not as a patient. So this is the difference from all other therapies. Like in other therapy, the client, the person who is having problem is treated as patient, not, and here the it is treated as person. So client is an active rather than passive agent for the change. So in other therapy, therapists or counselors are more active. They play more active role than the client. Here, the counselor's job is to help the client in playing a active role. Some essential components are for this technique is empathetic understanding. And empathetic understanding means you try to understand the problem according to patient's point of view, client's point of view. Then only you may understand the thing that the client is suffering and what type of suffering he is having. Unconditional positive regard. There should not be any condition, and client, whatever client is sharing, you should have regard for that. Congruence are essential components. So, like the counselors, punctuality, the personality, other things should be congruent. There should not be discongruence among the in the behavior of counselor. The counselor should always pay respect for the clients. Always pay respect to the client. So even though the client has shared something immoral, something unethical, something illegal, you are not supposed to disrespect on that ground. So the counselor should avoid confrontations, and the problem is solved immediacy, then concreteness and self-disclosure. So all these components make the therapy client-centered therapy. All these techniques are used in client-centered therapy. Let us see a little bit detail in about these three things, which are the core concept of uh, client-centered therapy. Empathic understanding. So understanding the situation from the client's perspective helps in promoting rapport building. So, so it is very important to understand what client is saying according to client's perspective, not according to your perspective. So it will help you in establishing a rapport. Unconditional positive regard. Treating the client as a worthy person, irrespective of his actions, feelings, thought, background, etc. Congruence. It means consistency in the counselor's thought, feeling, and actions, which help client perceive the counselor as a real, responsible, reliable, and dependable person, and not as a fake or a dramatic person. So in my earlier lectures also I have mentioned this thing. The therapist should be genuine. The counselor should be genuine. It means you are not supposed to um dramatize or play a role as a counselor. No, you are a genuine person. The language, the way you speak, it must be genuine. You are not supposed to twist or accent use accepted language in the way some other advertising companies are using. Not like that. It should be real. Respect helps the counselor to accept the client for who they are working or treating. Confrontations helps the client to have a realistic and accurate view about himself, others, or his situations. Immediacy dealing with problems with here and now attitude. If the problem is there, so we have to deal it here and now. Not that we should go into a past, then we explore so many things, then we can discuss more. Concreteness, like focusing on a specific, definite, and vivid points rather than being vague and general. Self-disclosure, sharing personal information by counselor. It strengthens relationship and building trust. So it's not that always you are sharing your personal views or your personal experience with the client, but whenever it requires, you share your personal experience. Empathy is seeing with the eyes of another, listening with the eyes of ears of the another, and feeling with the heart of another, given by Alfred Adler. But basically, empathy means you are very much concerned about the client's problem and you are trying to understand this problem. So, this effort is basically showing empathy. So, and core counseling skills. So, see the basic counseling skills in any types of counseling. It requires like trust building or rapport building. We have discussed already. Attending skills, like it is abbreviated as acronym is as solar, like sitting squarely. So you are not sitting like this, like your back should not be touching the backrest of the chair. So you are little bit lean towards the client and your ear is toward the client, as if you are trying to listen the client. Then open posture. You should not sit like this, cross hand, cross leg. So your posture should be open. It shows that you are open of any kind of information which client is giving. Then lean forward. As I told you, you are not supposed to sit like this. So you are little bit lean towards the client. And don't forget, there is always a table between you and client. So client is sitting in front of you. Then maintaining eye contact. So this is very important. When you are talking to client, you have to maintain eye contact. But remember, eye contact doesn't mean staring the client. Okay. Then R for relaxed body language. So the counselor should be relaxed. If counselor is tensed, if counselor is anxious, then the body language may not be positive. Active listening. So for meaning and understanding, active listening, like whenever if client is saying something and you are listening, this is called passive listening. Active listening is when client is saying something, you are inquiring something, you are saying yes, hmm, head nodding sometimes, not always. Okay, and sometimes you are shaping the clients talk also, because sometimes some of the clients they have tendency to give unnecessary details, so it will take lots of time, so you shape their narrative also. And examiner counselor should have observational skills, like they should observe the client's verbal and non-verbal behavior carefully, so it will give idea in understanding the client. Tone of the voice. So if your voice is not proper, the tone is not proper, the volume is not adequate, so it will create problem. So you have to focus on your voice. Skill of question asking, like there are two types of questions: closed questions and open-ended questions. So you all know that we should always start with the open-ended questions, so client will get lots of opportunity to express themselves. If we start our interview with the closed-ended questions, then the client will say yes, the answer will be yes or no, or just the some few words or phrases. Then you have to ask lots of questions. It may irritate the client. So best way is to start with open-ended questions. The counselor has to do paraphrasing. Paraphrasing is basically restating of what the client said, thus focusing on the content of the conversation. So if client said something, so you are just summarizing it or reflecting it or paraphrasing it. Reflection of the feelings similar to paraphrasing skill, but it focuses on reflecting on the feelings in verbal and non-verbal expression of the client. So whatever client has said, you say, oh, you felt very bad that time, like that. Summarizing, focusing on the main points of an entire session or a particular conversation. So this is the job of the counselor to summarize before ending the session, or if some the topic is going to be changed, so summarize the topic. Coming to case history and interview. Case history means collecting lots of information on a particular heading from the client or his relatives or any caregiver. So case history basically it is a planned professional conversation that helps the counselor to find out about the client's problem or symptoms, feelings, fear, difficulties, and get an insight about the client's illness. It gives in-depth information about the client, and like there are subheadings like identification data where you write about the name, age, gender, demographic details of the client. Then presenting problem, under presenting problem you are writing out what the problem client is having. So the client may say he is having low mood, not feeling well, not eating well, sleep is disturbed. So all these things come under presenting problems. Then you inquire about the symptoms. So when the first symptom started, how it started, what happened, how these symptoms affected the biopsychosocial functioning of the patient's occupational functioning of the client. So all these things you have to inquire. Then behavior of the client, how the behavior of the client during the interview and in a recent past, is it change or same, or is there any oddities in the behavior? Physical appearance also you have to see how the client is dressed up or comb the hair, clean or not. Physical appearance, and verbal and non-verbal cues, body language and gestures. So all these things you have to keep in mind while you are collecting history. So like interview is the best method to collect the lots of information. It is a very cost effective method. Both verbal and non-verbal behavior is elicited during the interview. It is flexible, like the counselor has flexibility to ask anything related to problem of the client, about his family, about his occupational stress, about academic stress, anything. So it gives lots of opportunity to the counselor. It helps in building rapport and therapeutic relationship, and it helps in making decisions. So basically, when you are conducting interview, it helps you in making decision, and it helps client also. Coming to a very specific technique which is called psychoeducation. So whenever there is a problem, whenever there is a client with problem comes to you, so you have to tell the client about the problem. In our culture, in our country, most of the clients they visit with their family members or friends or some caretakers. So this is the job of the counselor to educate them about the illness. So the process, the technique which the counselor use to educate the family members, the client, is called psychoeducation. It is not just giving just information. This is the basically counseling technique. This is basically one type of psychotherapy called psychoeducation. So in psychoeducation, basically counselor give information to the client or family members about the condition or psychological states of the client. It is evidence-based therapeutic intervention for client and their family. And there are several studies which have shown that if psychoeducation given to the client, it reduces their distress significantly. It means this technique is very effective. So what information we are giving? We are giving information about causes of the problem, that etiology, symptoms of the problem, what are the symptoms he is having, prognosis, what are the possibility of improvement or getting cured, and what are the treatments available for this problem. So remember here, while we are talking about the causes, even though we know that the problem in the child is due to parent marital discord in the parents, but we are not directly blaming parents that why this child is having this problem because you both are fighting. Rather than we take this issue indirectly and help the parent to resolve their marital discord, to work on their marital disharmony. Same way, while we are talking about prognosis, we do not, even though the prognosis is very poor, the all indicators suggest that the prognosis is very poor. We are not going to say that this is not going to cure. No, we try to instill hope in the patient, but the hope should not be false. So it is a very tactfully the information is given, and then we'll tell about the treatment if the client may require counseling, the client may require treatment medicines from psychiatrist. So all these things should be given to client. So if psychoeducation is given properly, it work like a wonder. So just so there are two ways of giving info. One, you are just going to share the information with the client. Another way is to ask to elicit the information from the client first, then provide the information. So this is the best way. Eliciting, then whatever information they are having, and then you are correcting and improving their information. So this is empathetic and supportive environment is must for psychoeducation. Learn problem solving and communication skills, enhances family well-being, decreases rates of relapse, increases the rate of recovery. Psychoeducation can be delivered in one-on-one session or in groups. So in group setting also it can be given. Indulging in the involving the family is the priority because family is the primary source of support in case of any psychiatric psychological illnesses. Another thing is conflict resolution. So there might be, we all are facing lots of conflict and we should know how to resolve it. So we have to give some training to the client so they can resolve the conflict. So what is conflict? Conflict is basically situations that naturally arise as we go about managing our day-to-day activities as well as complex and stressful life circumstances. Some characteristics of conflicts are natural and unavoidable part of life based on beliefs and personal choices. If left unresolved, may disturb physical or mental well-being and relationship status. And there are various types of conflict, like interpersonal, intrapersonal, intergroup, intragroup. So various types of conflicts may be there. We should know how to resolve such conflicts. Conflicts can be positive and negative. Positive conflicts, like they complex people to think about the problem and find its solution, gain new information and perspective about the problem. Negative conflicts, they can pose the threat to physical and mental well-being and may hamper relationship with others. Healthy coping styles help in resolving conflicts. Another thing is crisis intervention. So, how to intervene at the time of crisis? Sometimes patient come with crisis, and we have to intervene there and now only. So, what is crisis? Crisis is a traumatic event or experience an individual faces in his life, such as natural disaster, death of a close relative, or any illness, life-threatening illness diagnosed by the doctor. For example, cancer or HIV. It could be crisis could be due to divorce, separation, accidents, robbery, fire, financial loss, etc. So, crisis intervention is a technique applied to give short-term urgent assistance and support to individuals who experience crisis. So, for crisis intervention, there should not be appointment, like you are not going to tell that okay, you meet me next week. No, you have to intervene there only. So, it is short-term urgent assistance. So generally, some of the counselor, those who are working in hospital setup, in emergency setup, so they provide crisis intervention then and there only. It is basically very a brief form of intervention. So what is the goal of the crisis intervention? So it stabilizes symptoms of the traumatic events caused the distress. So there may be lots of symptoms due to event trauma crisis which is causing distress, so it stabilizes them. Mitigate the impact of an event or symptom of distress to facilitate a normal recovery process, restore adaptive functioning or functional capabilities, and assist in decision making. So these are the goals of crisis intervention. Let us see the what are the different various elements of crisis intervention. So it is basically assessing the situation. So counselors first job is to assess the situation, empathy and acceptance of the client, being assertive, conceptualize or define the problem, then psychoeducate the client, complete and accurate information to the client, reduce the possible damage, offer help or support to the client, unconditional support and help in building resources, develop strength and coping skills of the client, alternative creative, and less harmful solutions to the problem. Mode of counseling is grief and bereavement counseling. Grief is inevitable. We all know this. Either we have to see some death in family, loss in business or job, quarrel with someone. Death, in case of death, the grief will be more. So it is a reaction to any form of loss and includes range of feelings from sadness to anger. Most of us deal with the loss on our own, but some of us need external help. This form of counseling helps in understanding negative emotions and their effects on personal growth. Okay? So that's why grief and bereavement counseling is required. So Kubler-Ross, basically, she was working with a terminally ill patient, has given a model of grief, and she described it as five stages of grief. In acronyms, it is called DAPDA. The first stage is denial. In denial, the person may not accept there is a loss. For example, when the person is diagnosed with cancer, the family members or the person may deny, no, how can it do that? I am very healthy. Okay, same thing happens when someone tells someone died. So no, no, how can? Yesterday I met him, he was very fine. So this is denial. Then anger, why this happened? Why this happened to me? Why me? So this concept comes, lots of anger will be there. Then the person starts bargaining. God, please forgive me. I don't want to die now. I will do everyday puja. I will offer namaz every Friday. I will go to church every Friday or every day. Okay, such type of, if you cure me or if my illness will be cured, I will offer this much money or I will do this work, social work. Such type of bargaining will be going on. But then the person may develop depression because the symptoms are increasing, the illness is increasing, and at last, most of the patients they accept, yes, they are having illness and they are going to die. So despite of these stages, grief is unique for every individual. It's not that all individual has to go like these stages. Like sometimes the person may starts with anger, sometimes with depression. So but definitely acceptance come last, and not all patients or family members they accept. So techniques used in grief counseling talk about disease or the loss of the client is going through, assess whether grief is associated with trauma, identify the guilt proneness and its impact on self-image and self-efficacy. So these are the job of the counselor. So let us sum up of unit 7 what we have read till now. We have discussed about the rapport building, client-centered counseling techniques, basic skills of counseling, case history and interview, psychoeducation, conflict resolution, grief and bereavement counseling. Now let us see the unit 8. This counseling skills and techniques to music therapy, art therapy and play therapy. Let us see them. So all these types of therapies, music, art, play, drama, dance, are called expressive form of therapies. Basically, they are creative therapies. Okay. So these are basically expressive form of arts, and these are used to express emotions, anxieties, fears, worries, and uncertainties. Use of arts like can be for self-expression and can be for therapeutic purposes. Let us see the music therapy. Let me make it clear that music therapy doesn't mean whenever you are tensed or you just listen the music or you just sing the song. No, there is some theoretical basis behind that. So it is, music is a universal language. Even though you do not know such thing, you can enjoy even listening in the medium of expressing all kinds of different emotions. We all know this. Then different genres like rhythm and beat, classic rock, trance, romantic, Mozart, etc. So there are various types of music available. So it is defined as an interpersonal process in which the therapist uses music and all of its facets to help patients to improve, restore, or maintain health. American Music Therapy Association, called music therapy, is the clinical and evidence-based use of music interventions to accomplish individualized goal within a therapeutic relationship. So it music also used as therapy. So music can be used as a powerful tool to enhance mental well-being of an individual. Emotional, psychological, physiological needs are addressed through music therapy and evidence-based therapy. So there are lots of evidence, and so music acts as a mode of communication between the client and the therapist, provides an outlet for repressed thoughts and emotions. So types of music-based interventions. So music-based interventions in healthcare, music medicine, music therapy, and other music-based interventions. So what are the benefits of music therapy? So different parts of brain remain active while listening or learning music. For example, hippocampus, cerebellum, visual cortex, and physical aspects like help lowering hypertension, increase muscle relaxation, lower heart rate by calming the client. So there are certain music, if you listen like a normal or very relaxed type of findings, you will get on easy. So you get relaxed and psychologically, like it reduces your stress, fatigue, it increases your concentration, memory retention, communication skill development, etc. So physically it relaxes you, making you calm down. Psychologically, it's mentally relaxed. Let us see the approaches to music therapy. Behavioral music therapy based on behavior therapy, improve or change behavior. Music is used as a reinforcement. So particular behavior is targeted, and for that music can be used as reinforcement. So whenever the behavior occurs, the music is given. So developmental music therapy, music is used for psychosocial growth, improve interpersonal issues, cognitive skills issues, sensory motor delays, etc. Medical music therapy used in medical facilities, physical, emotional, and psychological well-being of the patients are emphasized, conducted by qualified music therapists, includes treatment plans, composition of the music, with great emphasis on the relationship between client and therapist. In India, like the music therapy was used since long time, not as a treatment, but it was as a part of the life, and sometimes it was also used as treatment. So individual association of professional music therapies started in 2011, but if you remember that there are certain ashramas in ancient India where if someone is bereaved, someone is excited or having manic features, depressive features, or someone is under highly stress, so they were managed with music therapy by the gurus. So this Indian Association of Professional Music Therapists, it started in 11 and began operating in 2018. The goal of this is sharing information about music therapy, creating and developing formal educational program for music therapy, providing connecting platform for all members. Now, let us see the art therapy. It involves use of different art forms for achieving mental, physical, and emotional well-being, expression of feeling and thoughts. Art therapy coined by Adrian Hills. Two approaches to art therapy, like self-expression, like focus on creativity, artistic quality, and aesthetic aspect. And another one is delve into subconscious part of an individual, projecting onto the contents of their art. So overall improvement in psychological and physical well-being of the individual of cancer, brain injury, trauma, and depression can help in understanding and reducing load of emotional difficulties and distress. Techniques generally are a house tree person, draw yourself as an animal, three wishes, drawing completion, draw your inner child. Let us see the play therapy. What is play therapy? Play therapy is not just playing, but play is used as a mode of therapy. So we all know that play is the language of children with no words or tools to express. Association of play therapy is a systematic use of theoretical models to establish an interpersonal process wherein trained play therapists use the therapeutic powers of play to help clients prevent or resolve psychological difficulties to achieve optimal growth and development. We all know that it is developed by Anna Freud, daughter of the Freud, Sigmund Freud, and Melanie Klein, and it's combined therapy and play. The first used by Hermann Helmut in 1991. In India, emphasis is given on the playway method of learning in the early years of education. In our country also, the children were exposed to various types of play. Let us see the approaches of play therapy, psychoanalytic and psychodynamic therapies. So they basically use play therapy to understand the unconscious or hidden or repressed needs of the client. Two main approaches: Kleinian approach and Freudian approach. And the Jungian play therapy basically focus on the archetypes of people and how it evolves over time. And the child tends to believe that the play area to be a safe space to display their unconscious feeling. Experiential play therapy, Carol and Norton has given it. Everyone learns through their experiences. Children also learns from their experience, and children starts making meaning and start to resolve their conflicts and issues. Cognitive behavior play therapy is Susan Nell, and cognitive behavior therapy method for kids aged 2.5 years to 6 years. It's more suitable. And various forms of arts are used like role play, modeling, use of toys, etc. Play therapy, family play therapy given by Safer, and combination of family therapy and play therapy. Irvin and Molly Creep, Steve Harvey, some renowned personalities in family play therapy. They have published several articles and books on this issue. What are the techniques used in family play therapy? So bubble breathes technique, it's like relaxation, reducing anger and stress. Beat the clock, like completion of small task in on time and get rewarded. Sense of accomplishment. Garbage bag technique, a bag in which the child puts his worries, anxiety, anger, fear, negative emotions, helps in viewing problem from a new perspective. Turtle technique, gain control on the anger, develop a strong positive emotions. Here, like the turtle, you pause, you go slow, get inside, and then manage your anger. Role play technique: child puts on mask and costumes of a superhero, for example, Batman or Superman. Metaphors, symbols, and stories are also used to articulate the thought, concerns, fears, and fantasies, and these may produce shame and guilt, fear in child if not understood properly. So let us sum up the unit 8. So we have seen here the expressive forms of arts, and we have discussed three therapies: music therapy, art therapy, and play therapy. Now let us see the unit 9. It is here we are going to discuss about the dance or movement therapy and drama therapy. So the objective of this unit is to explain the meaning and concept of dance or movement therapy, describe the approaches to dance or movement therapy, define drama therapy and describe its key concepts, describe the stages and techniques in drama therapy. There has always been an emphasis on mind-body connections can be elicited by the help of different dance forms, both classical and folk dances in festivals and celebrations. There was a tradition in India in the temples. There used to be dance on certain occasions, and there were expert dancers. Sometimes public also dance. Like this tradition is still followed in several sects of the Hindu religion. In ISKCON temple, you will see the devotees they used to dance and chant Hare Rama, Hare Krishna. So in India, the dance was not only a form of entertainment, it's a form to please the God, to relieve the tension, and so many other things. So dance involves expression of one's mind through various facial expressions and movements. Dance was first used to therapeutic purpose by Marian Chase on schizophrenic and suicidal parents and patients in Western countries. However, in India, it was long there since long back. She remained first president of American Dance Therapy Association, a movement in depth written by Mary Whitehouse, based on Jungian principle of active imagination to decode spontaneous body movement. So various approaches of dance and movement therapy. Chess approach is like pioneer of dance therapy. It's like interventions like body actions, symbolism, kinesthetic empathy, a rhythm group activity, and facilitates in non-verbal expression of inner feeling and communications. Freud's approach is fascinated by work of great artists and the work of artists as an expression of the use of defense mechanisms called sublimation. So according to Freud, dance is a sublimation of unconscious sexual desires and emotions which can be expressed in constructive and acceptable way of dance. Usage and techniques of improvisation. It helps the client in becoming spontaneous in his reactions and move away from all typical ways of reaction. Whereas Winnicott's approach is basically techniques of play and imagination. Individuals feel increased sense of worthiness of their lives through art and dance expressions. It also works on false self, but external self always trying to be in conformity to the society. So true self, the inner self, creative self, which develops through art forms like play and dance. So we, according to Winnicott, we all generally use false self. So dance basically provides us opportunity to express our true self. So Mary Whitehouse, pioneer of this therapy, included movement in dance. The unconscious and one's inner listening is explored through movement in a self-directed manner. Integrative dance therapy. Based on integrative therapies used in some German countries, integration of the concepts of jazz, White House, and Spanak also uses the practical work of 2D school and some concepts like live body concept, dance improvisation, dance compositions. So basic concepts of dance and movement therapy, like body attitude. So it's like in dance and movement therapy, the body is used as expression of the unconscious or unfulfilled desires or for the growth. How we experience the human body can be understood from the body image. Kinesthetic awareness, ability to sense oneself physically or both internal and external level, and kinesthetic empathy, like therapist awareness of the client based on the body inaction to do or to begin doing helps in creating awareness and transforming oneself in terms of behaviors rhythm, essential component of human interaction and conversation, a fixed pattern, for example circadian rhythm. Embodiment, revitalizing the body, re-establishing the inactive sensory perceptive bond, and regaining access to the emotional wealth. Sensitization. So action-oriented types of psychotherapy that stimulates the body senses, five basic senses we know: visual, auditory, smell, taste, and touch. So an intra or interactional model of dance and movement therapy, like intra-actional system, self-image and body image, how the individual perceives the body and self. Interactional system focus on client's ability to develop connections with their environment as a social being, and communications and interaction, interpersonal dynamics. It is like basic attitude, selfhood, communication, interpersonal dynamics. Uh, a transitional space, like imaginary space created in the context of drama, which displays the basic principles of trust and comfort between the client and therapist. Metaphors helps in interpreting emotions, thoughts, and behaviors differently. Concrete embodiment, transforming the abstract into physical form. Dramatic projection, act out inner feelings and ideas. Techniques of drama therapy, stimulating creativity and spontaneity, role playing, scripted roles, improvisational role, speech and storytelling, projective play, acting out, and masks. So let us sum up. Uh, so we have in this section discussed about the dance and movement therapy and drama therapy. So today we have discussed about three units: Unit 7, 8, and 9. Unit 7, we have discussed about counseling techniques, basic skills of counseling, client-centered counseling, and brief grief and bereavement counseling, conflict resolution. So in grief and bereavement counseling, we have discussed about the Kubler-Ross Dabda. That is like when there is a crisis, when there is any loss, there is a reaction. The people react in a different way. But according to Kubler-Ross, there are five stages of such reaction. So first will be denial. The people deny, no, it is not possible. It can't happen. Then anger, then bargaining, then depression, and then acceptance. So, uh, and then we have in conflict resolution, like conflict is sometimes important to for the growth, but when it increases a lot, it may create problem. So this is the job of the counselor, to teach conflict resolution skills to the clients so they can resolve their conflict which arises in day-to-day functioning. Uh, in another unit, when unit 8, we have discussed about the uh, expressive form of arts, or basically expressive form of therapies like music therapy. We have discussed about the art therapy, and we have discussed about the play therapy. So music therapy was used in ancient India since long back, and same way, like in unit 9, we have discussed about the dance therapy and drama therapy. So music and dance, basically, they were part of the Indian culture. In each and every occasion, there is some music, there is some dance. Okay. So earlier it was only performed in the temples. Then it started in other occasions, personal occasions, social gathering, in various states, like in Punjab. Lohri is celebrated. In Assam, Bihu is celebrated. So it is dance and song. So this basically in the South India also, Onam, Pongal. So lots of festivals are celebrated with dance and music. So, with this, then we have discussed about the drama therapy. Drama is also basically self expression, helps in self expression. So, thank you.